is very difficult to get a diagnosis of mast cell or histamine intolerance because the diagnostic criteria isn't very clear and the testing isn't very good.
I know so many people have already written on your, look, we'll call it a viral social media post about what kinds of symptoms are they seeing that they think are associated with these issues, mast cell.
Yeah, so first thing first is that a lot of people don't even know what we're talking about. What is mast cell? What is histamine intolerance? We've done several lives on this, and the first thing is that it is very difficult to get a diagnosis of mast cell or histamine intolerance because the diagnostic criteria isn't very clear and the testing isn't very good.
It's crap. I want to jump in on there already. And not only is the testing, just not standard, but the training at the doctor level, I mean, at the provider level, there's not really a lot of training here either.
Yeah.
So uh, it's not something that gets discussed beyond just some common symptoms. And like you said, it's related to so many things.
Yeah, and last week we had somebody who just commented that this was somebody in Switzerland, and she said she was told by her doctor that her mast cell activation and histamine intolerance syndrome was a diagnosis that's not real, and it's somebody's imagination, and it's all 100% based on anxiety and past trauma. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training.
Then we're getting back to the medical gaslighting once again, which I know was another viral post, because to be told that something that you are truly experiencing and have symptoms that you can even show isn't real.
There's just such a wide variety of symptoms. To begin with, when we're looking at mast cell or histamine intolerance, it is, in a sense, in the field of the allergist because people identify this problem. Mast cells are allergy cells. Just a quick little picture, okay? I'm going to show you guys. Mast cell is one of the white blood cells, okay? It floats around your blood. And if there's pollen, environmental things you're allergic to, or if there's food that you're allergic to, these mast cells will have receptors on their body that says, we don't like that. And when that food particle hits that mast cell, the mast cell says, ooh, red alert, something we don't like, protect the body. What are we going to do? Secrete all these granulation of these, what we call histamines. All the little orange dots are histamines. Histamines, as you guys know, and you've heard about with antihistamines, is related. Most of us think about it as like the itchy eyes, the runny nose, maybe asthma, wheezing, or histamines can cause anaphylactic type reactions with the swelling of your mouth. Your throat might feel weird, difficulty swallowing. Some people have problems breathing with it, and then the itching and the hives. Classic, what we call anaphylactic type allergy symptoms or seasonal allergic symptoms. That's not necessarily what is mast cell activation and histamine intolerance. But most people think that just having an extreme version of that is what mast cell and histamine intolerance is. And while that's true, that's a small wedge of the pie. What I actually see is that there's so much more histamine related reactions that we're going to go into because you guys are bringing these symptoms up. All right. And as we go into these symptoms, I'm going to explain the scientific reason why mast cell reactions and histamine reactions cause so many different symptoms that are baffling to your allergist, that are baffling to your primary care provider because they don't realize it. They think, and they're misinformed, that it's just about really bad allergies. Okay. And then the testing and diagnosis suck. And then we have people with literally a myriad of symptoms all over the map. Marissa just says, it feels like my chest is tight, right? It's hard to take in deep breaths. This is some classic presentation, right? But then again, is that, allergic, and often people will put people with those type of allergic reactions into the panic attack group as a mental health disorder and it not being real. Heather's bringing up here diarrhea. Would you guys think that diarrhea is actually an allergic related symptom? Could environmental allergens, could food allergies cause diarrhea? And I know Dr. Jason's already shaking his head like a bobblehead. What do you think, Jason?
No, absolutely right. And I think that that's what's really misunderstood is that this is a whole system-wide reaction. This isn't just, localized to the eyes, to the skin, to the throat. These are real system-wide, body-wide reactions. And again, not trying to jump back on this, but going back to the panic attacks, and I know that we've experienced this as providers with our colleagues. A lot of doctors, if they can't connect the dots, they literally will default to a psychiatric condition. So I mean, if I'm not smart enough to figure it out, then it's not my problem, it's your problem. And here's the psych med of the day. And then unfortunately, people now are on psychiatric medications that they may or may not have needed, and they're not getting the underlying causes addressed.
To learn more about mast cell activation syndrome, histamine intolerance, or any allergic related reaction, comment in the comment section below, Mast Cell Help.